All right, we're back. How did you feel last time? What was the feedback?
Feedback was good. A few things to improve on. But yeah, overall, I think it was a good first effort. Managed to do it without any retakes as well. So I think that deserves a round of applause. But yeah, no, looking forward to this end of year wrap up and more in 2025.
Yeah, yeah, yeah. For me, it's the same kind of thing as well. When you get feedback from people, and you also give yourself some feedback, reflect and say, "Oh, okay, what was amazing was we just sat down and we talked about things."
Yeah,
And
that's what it was, just a conversation.
and no matter how much you prepare, because you keep delaying doing these sort of things, thinking, well, we're going to get it better, so we got to prepare. Then you realize actually just you walk in and you just start talking and you don't stop talking. So I thought that was great. Yeah.
Yeah.
So this is our last one this year. Our last. So I learned the word pod. I didn't know that there was a word, such a term. So our last pod of the year, and so I was thinking, there's so much we could talk about. But I went to a few conferences recently, as you know, the last one being at the Care Quality Commission head office in London, and there were so many themes that got us thinking. And to start thinking about what's happened in the year. It's been such a dramatic year in many ways. The endless doctor strikes. Nurses, healthcare workers striking, and defining what is a junior doctor, for example. People, and then governments, different governments. We've had several governments pre and post COVID, and then we had the landslide victory of the Labour Party under, say, Keir Starmer. So every government comes in with new ideas. They want to radically change the way things are done. We've also had a year where the regulators in England, the Care Quality Commission, have had such a difficult time. They were declared unfit for purpose in various reports, and they've had to do a huge changes in their leadership to try to steer back the regulator, in a position where they can effectively regulate the sector. And so for us as a business, when you're sitting at the Care Quality Commission headquarters, and directors and senior executives of the Care Quality Commission are admitting that, look, we've got things wrong, but we want to work with you to improve things. We want other countries, the Americans, people in Africa, in Asia, in South America, they're looking up to CQC to see how they get out of this quagmire, And the guys are very positive. So for me, that was quite good and reassuring to sit with the regulators and spend a day with them, and then start to understand how keen they are to turn things around, but also they want us involved. Because sometimes I've always felt that we were not part of the conversation. Because as private companies, you've got government bodies and these third sector organizations that are preferred sometimes. They're the ones that are in the room, and we are quite often excluded from those rooms. So for me, that was a big thing this year, to end up the year with an event at the Care Quality Commission, the organization that we look up to, despite all the challenges they've had, but we have always tried to fill those gaps as well in the sector. So I did feedback to you and the team on some of those discussions. So I don't know, from your perspective, how would you wrap up the year based on all these things?
Yeah, I agree. There's been lots of different challenges. You've mentioned probably some of the main ones, like you say, changes in government, changes in the way services are regulated, different challenges, whether it be staffing challenges, internal challenges, patient care challenges, care delivery challenges. There's been so much really that has changed, and the fact that it's all happened relatively within 2024 shows you the sort of devastation that it's sort of left behind. But also for us as a business, it's really made us think, how best can we serve these clients? It's constantly changing. We're constantly having to innovate, come up with new ideas, customer-centric products and services, really, really getting good quality feedback from customers, hearing what the day-to-day challenges are, the operational challenges are, and building a product and a service that can meet that. So even from where we ended in 2023 to where we are now at the end of 2024, even our business has changed a lot with it, because like you say, as these other social political factors change, as the needs of really our clients change, we have to obviously change and diversify as well. So yeah, there's been a lot going on. We even when we looked at our budgets at the start of the year, the things we thought we'd be spending money on, we haven't. Areas where we've had to maybe invest more in to make sure that we can keep helping some of our customers, we've had to. Even some of the courses that we've had to develop with the content team, we've kept our subject matter experts very busy this year. Different requests, different things in the news, in the law that's had to be updated. And obviously we pride ourselves on a lot of those things. So, you've got to be able to walk the walk if you talk the talk, so to speak. So, it's been a challenging year. And even, the planning meetings we've got for 2025, you almost don't want to make too many plans because things could really change very quickly.
Changing so much, yeah.
So, no, I'm sure it'll be another interesting year. I think we've managed to do a pretty good job with a lot of the clients we have. I'd like to think we've been there to help a lot of them, and long may that continue next year.
So some of the things, again, when you look at the macro side of things, access to care and service delivery, because we work with the NHS, we supply to the NHS and some of the big private players, local authorities, but also the smaller SMEs, small to medium-sized enterprises. So when you look at waiting lists, hospital waiting lists reaching nearly 7.7 million, and that's people that have been waiting for over a year, nearly 400,000. Then when you look at social care delays, approximately 470,000 people waiting for care assessments or services. And then when you talk to some of the SMEs that we're working with, they're struggling to get work. Yet, obviously post-COVID, some of the reason why we've had to change a lot of the content, for example, in some of the courses, is because people that would be treated in a hospital or in some sort of step-down unit, they're now being looked after in the community by care workers, not nurses. So if you look at complex care, for example, people with complex care needs, and then also people that are on oxygen therapy, people that are that need clinical observations. So you think about it, traditionally in hospitals, these things would have been done by nurses, and where healthcare assistants were allowed to do them, they would have to undergo training and supervision, but because obviously they're working in a healthcare environment. But in the community, you're talking about people that don't have the exposure that, for example, healthcare assistants have in a hospital.
Would have in a hospital.
So some of them are completely new to the sector. Then they end up looking after people that are very poorly, multiple conditions. So they've got comorbidities, they're taking a lot of medications. And even in environments where you have nurses and doctors, comorbidity and polypharmacy, that these are some of the biggest challenges. To say, look, how do you manage people in long-term conditions? How do you ensure that they get the best outcomes? So we have had to adapt. So even building policies and procedures to say, look, if you're going to take these services on from local authorities or whoever is commissioning NHS continuing healthcare, business owners and managers need to prepare themselves as a business. So they need to learn as well. It's not just a matter of taking these services because they are there and you're in the right position, but hiring the right people, supervision, training those people well, putting in policies and procedures, then build a culture of continuing professional development, because even nurses and doctors, they have to do that and they have to actually show that they've done that. So that's for me, that's been one of the biggest issues, to say the landscape is changing so much. Even Lord Darcy, we're talking, the report, we're saying, look, he's saying, let's move from hospital to community care. But there's the infrastructure for community care has been decimated over many years of underfunding and other challenges. So from the front line, because I deal with the content, I deal with the needs analysis and workforce development issues, you're dealing more with the tech and the client needs as far as our customers. Mm-hmm. How have you and the teams navigated these challenges?
Well, yeah, like you said, there's been a lot of of these sort of incidences where even with clients, they're coming up with, they're asking for things for people in roles that you wouldn't normally sort of put together. You know, like you say, they're asking care workers to do courses that they're not really relevant to them, or maybe it's not within their sort of remit usually. So, like I say, one of the main things we've had to do is really invest in tailoring solutions. Obviously, as a business, we have a lot of what we'd call off-the-shelf products, where people can come to a website or speak to someone in our team, whether it be their account manager, one of our sales team members, our customer service team, or even on our knowledge base. But even when you look at our knowledge base analytics, some of the search terms within that knowledge base are very abnormal, let's say, or unusual.
Unusual, rather, yeah.
Yeah. So, like I say, what we've really had to do is almost look at that customer journey again, look at how we do needs analyses with organisations to sort of say, look, we can't just pigeonhole organisations or even professionals working in health and social care into these areas. We've got to be more flexible.
Yeah.
We've got to listen to the client's requirements, and we've got to have a sort of system or a process that allows that. So I think that's been one of the main things, almost rewriting our playbooks again, particularly for certain areas within health and social care. Obviously, we still want to guide, we still want to consult when we speak with people. It's not just about getting, the most money from them or overselling things that they don't need, but obviously we have to listen to what they want and what they want to implement in their business. So I think, that's probably the main answer really to that one. It's looking at building more tailored solutions, looking at other areas we can help them, whether it's with policies, whether it's with procedures, whether it's with the online training, whether it's with a blended learning sort of program where there's some in-person or on-site training and the rest is delivered virtually. There's been a lot of cases that even have come to my desk over the year, and you've sort of had to really think, how best could we do this? Obviously then bearing in mind the client's limitations and things like budgets, time and so on, because as we've already said, getting all your staff free on one particular day of the week is more challenging than ever.
Yeah, because we saw that with some of the work we did in London, in the Midlands, with the GP practices and dental practices, where there's a requirement now being enforced, which is right anyway, that the resuscitation training should be renewed annually, covering both pediatric and adult life support at level 2. Traditionally, they would do this training in-house, and there was no, pre-COVID, there wasn't really any enforcement of it. So they would get away with it in a way, so to say. Then during COVID, everybody got used to e-learning. But then after the pandemic, then the regulators now and commissioners are now asking, and it's rightly so, you do your needs analysis. You have to have the equipment for resuscitation. You have to train people to the right level so that they can actually, do their job safely and look after service users. They're better funded, but even for them, trying to get training companies to come in, it's a challenge to stop what you're doing and close the practice for half a day.
Every single member of staff being unavailable is almost impossible.
It's almost impossible, yeah. So again, you have to come up with innovative solutions to help them build capacity within those organizations and help them deliver the necessary training in-house with support.
That is a very interesting point. We've seen a lot of organizations taking that step now. So rather than just procuring a supplier like ourselves or other people in our field to come in and do this training to the wider group, it's obviously not cost effective for companies like ours to come in and train 2 or 3 people, then come another day and so on, because then your costs are going to rise. So to make sure it all fits within, the ecosystem of budgets and time and availability and supplier demands and so on, it makes sense to do it this way. Build capacity, workforce development. We've seen a huge rise in things like train the trainer courses, for example, where organisations are looking to promote senior members of staff who can deliver this training on site. Use a system where they can monitor, they can evidence that training, they can log it, and even certify learners, which is something again we've invested in from the tech side a lot over 2024, and we will be into 2025 as well.
One of the key issues I've also found, even when you talk to business owners, you go to these conferences and meet and greets, and you're talking to business owners. People start these businesses maybe because they are doctors, they're nurses, they're social workers, or whatever part of the healthcare workforce they're coming from, and they get contracts, they get started, and they start running the business. But if you look at a typical healthcare provider in the UK, you would have a structure, like say the NHS or even the bigger private hospitals, you'd have a structure where you have the corporate governance side of things. Then you've got the clinical governance side of things, looking after the professionals that are working. So you have medical director or chief medical officer, chief nursing officer, then you have different directorates and things like that. But when people start businesses, that one person or two people that are starting the business are doing everything. But they can only do things that they already know, for example. The things that they don't know as much, especially the governance side of things, I think it's an area that has been that has been overlooked, actually.
Okay.
And many business owners, because you have to think about it, you're setting up a business. You may be a good doctor, a good nurse, a good social worker, but now you're hiring people. So employment laws and other compliance requirements,
Yeah.
immigration requirements, because we know that quite a lot of health and social care workers are coming from from overseas. And then you need to think about the regulatory structure, the policies and procedures, the training. I remember somebody asking me about a matrix to sort of say, look, what is a training matrix? And you think business owner doing really quite well, they don't know what a training needs analysis is.
Yeah.
And never mind how to do it. They don't even know what training matrix is. And I've heard this many times. And you realize actually that, look, from a content perspective, we used to just we started with statutory and mandatory training, but you realize actually that you need programs to develop these managers. And there's a private company, we've tried to work with the funders, the commissioners, and the local authorities. It's quite difficult. And yet, actually, they are not doing enough to build managers, to build business owners. I know Skills for Care have done a lot in the past few years, but it's almost like people are not aware. But also, even the way things are done, you're still almost looking at the traditional distance learning model. Things have changed so much.
Exactly.
We need to change with the times. Yeah. So I find that a lot of initiatives that are there, people don't know about them. And even the ones that know about them, that have done some of these, even up to level 5 health and social care, they don't know the basics. So I'm sort of thinking, what are they teaching them? Yeah. So I don't know, from your perspective, how aware are people about what the requirements are, what is expected of them?
Yeah, I think it's another interesting question. It sort of touches on the last point I made about having to tailor things, because like you say, some people are coming to us with things that they don't even need because maybe they don't quite understand what the guidelines are. Even, what is classified as mandatory training, what is statutory training, what are the local authority asking us to do? Are there any other things that we need to be looking at getting done? What policies do we need to have in place? Some of the questions you answer, if you were to put them out there into public knowledge, even from pretty reputable companies, not even just the smaller companies, it is quite worrying, really, because ultimately these people could be looking after one of us one day. But it like you say, where is the access to that information? Yeah. If you don't know, you don't know. Is it available? What sort of training plans are there for people looking to go into running these sort of businesses? Yeah. Even from a consultancy perspective, where are those sort of people? Where are those sort of, whether it be a business or an individual advising these people? Is the funding there for that advising there? Because it obviously costs money. So I think we have seen some things that, like for say, we've almost had to put people right when they've come to us, whether when they've filled in maybe one of our needs analysis templates, or maybe we've gone, we've had a call with them, introductory sort of kick-off type call. We've had to say, well, you don't actually need that. Your nurses don't actually need to do that by law. And then, they're sort of surprised. So they say, but this other company said that we did have to do it. There's a
list somewhere. Somebody gave them a list.
There's this list that exists on the internet when you Google what does a nurse need, what does a carer need. But again, they're not thinking about things like the local authority. They're not thinking about a needs analysis of their environment, their service. Because again, although they're offering the same things as maybe another company down the road or another part of the country, there still might be needs that need to be addressed. So yeah, I think it's been challenging because you don't want to seem like you're telling as well some of these people what to do. They may have done it this way, but I suppose the analogy to think of is maybe you've always been doing it wrong.
Yeah.
And
You don't know what
sometimes
you don't know what you don't know.
you don't,
You
but
know,
you don't know
simple,
what you
yeah.
don't know. So they're challenging conversations, and I agree with you. The access to these things and building capacity in organisations, it seems to be a big gap, and the challenge is how do you address that gap when there's not really enough money to go around already, or there's other challenges that are maybe more important. These people are looking after very vulnerable people, majority of the cases, and this sort of falls down the pecking order. But the effect it actually has is very big, and we're seeing examples of that with a lot of our clients. So, yeah, I think it's a very, very good point, and more needs to be done from the powers that be. But organisations like ours can hopefully help bridge that gap, come up with workable solutions, and find ways of addressing those issues. Yeah.
I think you touched on a few points. I'll pick up on one, which is around the funding. There seems to be a lot of money out there for these sort of programs, capacity building.
You see them a lot, yeah.
Yeah, but a lot of people don't know about them. And also, it's the way the funding is distributed. I go back again to say we try to work with some of these arm's length bodies, government bodies, quasi-government bodies. They, on the outlook, they look like charities almost, but they're given a lot of money to funnel through for skills training, skills development, and one of the challenges is it's really difficult to have meaningful conversations with them. And even the commissioners, even when some local authorities, we've had success working with local authorities, but it's almost like there's funding that is ring-fenced for certain programs. And for private companies to get involved in those programs, it's almost impossible.
Impossible.
Right? And then I've had experience of dealing with people that had gone through those programs, and yet they still can't do a proper needs analysis. They still can't build a basic matrix. They can't work out how to structure the workforce development strategy for their organization. Right? So basics like, look, I've had to write blogs about the difference between statutory and mandatory training, for example, and how do you do your how do you check your needs? You look at the services you're providing, then the skills that you need to provide those services effectively. Then that builds your mandatory training. How often do you refresh it? If I follow some of the guidance that is provided out there by these organizations, we would not be able to meet the needs because they're so outdated, some of them. There's lack of knowledge even within those organizations as well. And also when you have a regulatory bodies failing as well, it means then we have to do a lot of heavy lifting to bridge that gap. Exactly. And it's not appreciated at all. What I've realized is not appreciated at all. At the higher tables, because there's a feeling that we'll be able to do it, and we just need more bodies to do it. So we kill off this body and we create another body, and but actually you are sort of skirting around the problem.
Revolving door, yeah.
And nothing is really being done that way. So funding that may be available for what I feel are pointless qualifications. I think we need more hybrid workforce development solutions, which involve some of the money being given directly to organizations rather than this piecemeal sort of say, look, we've got funding. Even the government is screaming every day that we're prioritizing emergency care, we're prioritizing this, we're going to put more funding. Or local authorities, we know that Birmingham went bankrupt. We know that a few other local authorities went bankrupt. And, when these bodies themselves, the commissioners, are going bankrupt, what hope is there for companies? So that's how, for me, we've evolved to sort of say, look, we're not just a training company. We're doing a lot of consultancy work that is sometimes not recognized, right? But actually, why don't we package that properly now? Because the margins have squeezed. They're very low margins in this sector. And the funding also, the way it's distributed, it's not fair, right? And the organizations that really need support are not getting it because they lack the knowledge, they lack the information, and they lack the funding. So if we package our consulting sort of services into tech that can be, then we train people how to use the tech. We train them on the underlying sort of knowledge behind the tech. Then you can build them, but they're not necessarily going on a level 5 course. You're building on the practical tools they need to set up their businesses properly and run them safely and effectively. And then you keep building. Then they can, then in the end, go towards the qualifications. But just going towards a meaningless qualification that does not actually address real life problems. No matter how many qualifications you put together, if you don't have enough understanding of the governance requirements,
how are you going to apply the knowledge?
Yeah, so that's and whenever I talk to people, even when I go to these conferences and I'm talking to people on the sidelines, that's the feeling that I get. So to say, look, we have a long way to go. And as a business, actually, as we go into 2025, we're going to have to work harder to educate people, inform people, without necessarily, sometimes actually without necessarily charging for those services. Because there's a need. Because actually, if they're using your system and then they're failing,
it doesn't reflect well,
it doesn't reflect well on us either. Yeah. So that's my thoughts. I don't know from your perspective. Yeah.
No, I completely echo those thoughts. Like you say, with some clients now, we're having to spend maybe more time with them.
Yeah.
Obviously, our business also has bills to pay, people to pay. We've got to be careful about how we utilize our resource. But at the end of the day, like you say, when their CQC rating gets published and you see it's not in the green, it reflects badly on you, because it's whether it's certificates, whether it's the policies, whether it's training that's been done, whether it's reporting that they're demonstrating as part of the audit. If it's got your name on it, you're potentially part of the problem in people's eyes. So, yeah, look, we know providers are having to go the extra mile as well, without maybe getting the recognition, whether that be financial benefits or whatever. So unfortunately, as we're in that sector as well, we're also challenged with the same issues, really. But no, for me, that's a very fair reflection of where we are. One thing I wanted to sort of touch on as well on this podcast was looking at the technological advancements.
Yeah.
And the integration of AI, which has been a big thing for the teams that I look after, that we've been really looking at AI, scrutinising it, and I know your teams have as well. So looking at how we use AI for the benefit of our business, but also then to pass that benefit on, really, to the customers we serve and the industry that we serve. So, yeah, I know from your side you were leading on the research into AI, obviously with that being your primary background. What have been some of your key findings, and how have you started implementing that within your teams and for the benefit really of the business as well?
So my background obviously is in research and development and innovation in healthcare, and as early as 2009 thereabouts, when I went into R&D, we were looking at AI technologies. We didn't necessarily call it AI at the time, but we were using a lot of decision support systems that are reliant on people building knowledge bases, databases. So what we're doing was looking at new guidelines and looking, when you look at the whole of the NHS, for example, you're looking at new guidelines, new regulations. How do you bring them into local environments? Of course, you can build policies and procedures, but policies and procedures alone and training are not enough. They're not going to change much because it takes a long time, actually, for policies and procedures to take effect. My experience is it takes more than 2 years, sometimes more than 3 years, for policies and procedures and training to stick. People will turn up for the training. They'll do it and get 100%. Then they'll go and do something completely different in practice. So we worked on clinical decision support systems where you are now changing the environment. how do people work. So instead of filling paper documents, you bring in technology where they now have to do everything using technology. There are many benefits, obviously. It's now a portable patient document at a local level. And if I'm sitting in a clinic at the back of the hospital, I can look at the trends, I can look at notes, I can look at everything because we are integrating everything in one place. So even with that, what we realized was that it's almost like a carrots and stick kind of scenario where you are enforcing usage of these tools and dangling, people have budgets and people can be penalized financially, or they look bad as a department almost because you're going to have to change the culture one way or another. So digitizing the work environment, changing how people are working is part of the solution.
Yeah.
But then you still find people doing bits of paper on the side.
It has resistance.
And those bits of paper don't end up on the permanent record. It's for their own use, but then they're not going to go.
But it almost might not as well exist to everyone else.
Exactly. And so that research for me was eye-opening and actually working in practice because I was coming from a clinical background. Then you go into research where you're going into academic research and commercial research. But for us as a business, that background was quite important because as a business, you have to find solutions to develop software, to develop content and other solutions fairly quickly so that you can get competitive advantage. And we started using AI around 2014, 15 when we started our initial business. Then when we evolved, 2018, 19, the pre-COVID sort of period, we were much better positioned than many competitors, than many NHS trusts even, right? But also even during COVID, we ended up having to work with local authorities, with the NHS and a lot of the government bodies that had not digitized a lot of the things that they were doing. And now that you can't go into these workplaces, it becomes a challenge. So for me, there's a word of caution there. Because now when you talk about AI, people think about ChatGPT. That's all
It's
they think
the one
about.
that comes to mind, isn't
And,
it? Yeah.
we've been using these solutions way before ChatGPT, right? And we'll continue to use them. But what we need to do more is to build AI into the solutions that we are providing. Our platforms need to be more responsive. Our platforms need to be adaptable. Our platforms should be easily integrated with existing legacy platforms. Organizations are using 6, 7 systems to achieve things that they can achieve with one good solution. So we start by understanding the needs. What systems are you using? You're using 5, 6 systems for recruitment, for e-learning, for policies and procedures, for supervision, HR. Okay, which ones are core systems that you need to run the business efficiently and safely deliver services? Then you mirror some of the systems so that they are working together and pushing data or receiving data from the other. And then gradually then you phase out some of these redundant systems.
Legacy systems.
Then in a way as well, you get to customize for the client. But obviously, a lot of people do not see value in that. It's almost like, if I'm paying this system and that system, then they're solving the problem, I'll be okay. Then they come to you when they have a problem. And you have to start by doing a needs analysis again. But they don't understand, I think, sometimes that it's a cost to us as well to do all that.
Yeah.
And
It isn't always reciprocated.
It's not recognized as a cost because, I need this, so you're going to give me that, right?
Yeah.
So I don't know, from your side of things as well, because obviously as businesses, private businesses, it's not just about making money. It's about thinking about how you build bridges, how you educate people, but also how you can adapt your solutions to their needs.
Yeah. No, I've found AI very interesting. Like you say, ChatGPT sort of made AI mainstream, but we've been using it in various different formats for several years, but I think even our use has increased in the last 12 months.
Yeah.
I think it'd be fair to say. Yeah, we're building it into the tech. Even some of the tech we're using, some of the software applications we're using, we're seeing the benefits of AI coming in, what it's helping us achieve, whether it be in marketing, whether it be how we serve our customers. Even our customer service, things like our response rates, our knowledge base accuracy, the quality really of responses that even our customers are getting now is probably better than ever.
Yeah.
And our recent feedback surveys suggest that as well.
Yeah.
I think, like I say, initially there's always resistance with these things. People don't want to talk to a robot, for example. They don't want this. They want to be able to find it themselves. But actually, even building it into ComplyPlus over the last 12 months, we've found that it's helping a lot of customers solve problems, like you say, and bridging some of those gaps, particularly the ones that, like you say, have got 5-6 different systems, 2 or 3 are doing the same thing, maybe one of them's doing something else. So rather than the obvious elephant in the room type thing of the cost saving, it's also the operational efficiency as well. So yeah, AI has been very interesting. I think we've got some really good ideas on how we can adopt it next year as well, both for the benefit of our clients but also our teams as well. And like I say, even from a staffing perspective, a lot of our team that I speak with are really engaging positively with AI. They're using it in very clever ways as well to perform their own roles and responsibilities in our company. But yeah, there is obviously that resistance. Health and social care as a sector has a bit of a stigma attached to it, that the old-fashioned ways, jotting things down on paper, telling people in a coffee room or whatever. Now, even with what Labour are doing with the technology focus, the digital transformation, these changes are going to meet with things like resistance and so on. But hopefully that's where companies like ours can help that transformation that the government are trying to enforce now across the NHS and England. Yeah.
Yeah. So it's thinking about the services that we're providing and where we can streamline.
Definitely.
Yeah, like now it's a problem. So, if you want to see a GP, it takes a lot longer now to see a GP.
Yeah, longer than ever, yeah.
But there are other ways that you could find solutions, for example, and even ordering prescriptions and things like that. So people are having to adopt some of these technologies.
Whether they like it or
and
not.
COVID, in a way, forced us to do that, because I remember...
It was the accelerator, wasn't it?
Exactly. I remember one organization, who I'm talking about here, where they didn't consider e-learning to be training. But e-learning is not real training, is it? There's a lot that you can do with e-learning. And even when you talk about AI and gamification and all that, you can make it quite realistic now. Simulations, you can do demos remotely, then people can then practice locally under supervision, and even the train-the-trainer models where you're saying, look, local supervisors and team leaders and managers can be trained to facilitate and cascade training locally, right? Without having to go back to university to do a teaching qualification necessarily. They can get to a low-level qualification like the award in education and training as part of the trainer program. But you make it affordable, because for us, actually, we have to think about affordability, because there's no point developing tools that no one is going to be able
to
pay for. As a private company, it's really difficult. And it takes me to funding again. I know we got involved in some work late last year and earlier this year at regional level, where there was funding for building capacity in businesses like ours. We ended up giving up and just basically bootstrapping our business ourselves to sort of say, look, let's just spend our money and build it ourselves, because the funding comes with so many strings, and some of them I felt unachievable, unrealistic. But also the funding is built on taking you back to the classroom. So there's money, but that money has strings attached where you're going to have to go for this section and that section. And so people are basically telling you things, and they're thinking, well, but I need systems. I need to build like even MI, VR, I need these tools. They're expensive. So the funding does not come directly to you. The funding is tied into these, I don't know how to call them actually. They're structures that are there that the funding is ring-fenced here and ring-fenced there. To get it, you have to go and attend a class and attend another class and this sort of thing. But I want to run the business. I want the tech. I know what I need to do. Okay,
Just
thank you
need
very much
access.
for the lecture. But now, what do I do? So
Yeah.
I don't know how you feel about that. Because, okay, that was the previous government, to be fair. And I don't know what the new government, how
to
things
do
have
with-
changed. But
yeah.
personally, I got fed up. Because I thought, nah, it's
Well, like you
so
say,
a waste of time.
it became a chore, really, like you say,
Yeah.
to apply for this
Yeah.
funding and the hoops you had to jump through.
Mm.
I think also the requirements of the funding and the expectations on the back of the funding were quite unrealistic. Like,
Yeah.
I think the last one that we went for, we had to create 2 or 3 new jobs for quite a low amount of money. I won't
Yeah.
disclose how much it was, but it wasn't anything like the cost of employing 2 or 3 new people into an organisation. So you sort of think, if you're going to penalise organisations, whether it's small enterprises or even big businesses, and put those sort of almost tariffs on them just to get access to this initial funding or access to this knowledge or whatever it may be, it was a real big deterrent, because who can promise those things? We've talked about quite a lot in this podcast already about the political landscape. We know that even the national insurance changes that are going to come in April are going to have huge impacts on jobs across the country. So when those sort of things, I think, are put on the back of the funding, it's very difficult. And again, maybe only then the elite can apply for this funding, because they can maybe promise some of these things that smaller companies or growing emerging companies cannot. So I think we had a lot of challenges with it. And I go back to that word, it becoming a chore. They don't make it a straightforward process. You're speaking to maybe different people, so you're bounced around different people, whether it's Zoom meetings, whether it's in-person meetings. So again, it's time. Some of those meetings you have to prepare for.
Yeah.
Then you have to go away and
Invest
fill
again.
a
Yeah.
thesis almost in. So I do have a lot of sympathy for other businesses trying to go down that route, because it's not easy. Some people may say it is, and maybe some of the funding available is easier to get access to. And like you say, there are probably changes coming with the government change as well. But in our experience and the people that we speak to, it's not been an easy ride.
And you mentioned about the national insurance issue. You have to think very, very carefully now before you put a job out. Sort of say, is it really worth hiring people? Do you just subcontract that work to another company, or perhaps in the region, or local company? Because for a government that is claiming to be business friendly, every week I get more and more disappointed. I'm not trying to be political about it at all. Look, we've had several governments in the past 6 years, but this government, considering that they had a huge mandate, 5 years, and we've only done how many months? 7 months, 7 months, whatever it is
months,
now. I'm tired already. Every time they open their mouths, I'm just sort of thinking, God, what are they saying today now? I'm prepared to be shocked every time I read what the Prime Minister is saying or what the Chancellor is saying. The environment, to me, feels anti-business. And for a business like ours, perhaps it's not such a bad thing, because we can digitize a lot of these things. We can automate a lot of things. We're already in tech, and we are used to bootstrapping the business by finding ways of doing things cheaper. I get it, like Donald Trump bringing in Elon Musk, because we work like that. We are used to that sort of environment where you're not waiting for investors, because investors come in, there's a lot of strings attached. To private equity come in, there's a lot of strings attached. And for us, even going to the bank to ask for a loan, it's draining to do that. So you learn to trade your way to growth. Yes, you may be slowed down in some things that you want to do, but maybe that's our comfort in a way to sort of say, look, no matter how difficult it gets, we're not going to wait for the government to make things easy. In fact, we are almost saying, what is the government making difficult so that we can improve the way we're doing things? Because I'm not expecting the government to come and save me. I'm not expecting the chambers of commerce or whoever. You sort of sit in these things and think, what am I doing here? Let me just go back and work.
Yeah.
I don't know how you feel, like.
Yeah, there's a lot of, like you say, there's a lot of frustration around, and particularly even, like you say, within health and social care, these sort of impacts are only going to make life harder
Yeah.
for those organisations, whether they're private or publicly funded. So yeah, again, it's another thing to worry about, isn't it? For our business, like you say, we have ways around navigating some of these things that are discussed in Westminster, and decisions that are made and policies that are put in place. But for other people, people are very important. They have to have people in the organisation. They have to employ people. They have to give people jobs. They need jobs to be filled, etc., etc. So, yeah, we again, it's just another thing that we have to think about as we go into next year, and how we serve people, and how we approach these challenges that we know they're having, and it helps us personify again the people that we're working with, and improve hopefully the delivery of our services.
Yeah. One of the things that I've found better really in this sort of area, in this area, is the partnerships. Like partnering with the educational institutions, partnering with service providers to develop solutions at local level. Then obviously you can scale some of those beyond. So again, I always think if you focus on the workforce side of things, workforce development for the whole sector or for the whole country, it's not always recognized, it's not always appreciated. But this is where I think the government could really shift policy to push more for those public-private partnerships. The funding is there, okay, put it through a local authority or whatever body, but actually work with private companies. What frustrates me is that a lot of organizations that are well funded, they'll outbid you no matter how much you work on a bid. They'll outbid you, then they get the contract, only to come back and knock on your window to say, "Can you help us with this, please?" And think, yeah, but you won the bid. I almost want to tell them to go somewhere, right? But I've learned to just bite your tongue in a way. Okay, look, what do you want? Then you've got the contract, the main contract. Then you subcontract some of the work to us. So for me, it's not a mourn in a way, but it's just an appreciating that the landscape changes so quickly. And even when the government is saying they're putting a lot of funding, I think it's going the wrong way. I was happy, actually, that a government minister this week was asking people like us, basically. Dominic Cummings called us the misfits and weirdos, people that have... he was a lot more diplomatic than Dominic Cummings. But you're saying, look, they say the right things.
Yeah.
Right? And I actually want to watch closely to sort of say, look, do they actually mean it? Because I think as a business, we should go and take the challenge. Say, look, you said we should come and talk. We're here. This is what we've been doing all along. We've pioneered ways of doing things, actually, that are now standard in the industry. Even the way we package some of the training and customize some of the training. And then you look at the whole workforce development where you're talking to government bodies actually and correcting them sometimes, right? So... yeah, I actually want to take the challenge with the government to sort of say, look, you wanted weirdos and misfits. I'm here.
Yeah. So, I think, I suppose the last thing we can discuss before we conclude is what are the plans for 2025? Where are we going? What are we going to be working on? What can people expect?
Yeah. Look, my experiences this year have shown me that there's a lot of work from organizations like us. We definitely need to use technology a lot more. A lot of these solutions actually you can't do without blending, the software side of things. software solutions for risk management, software solutions for performance management, software solutions for workforce development, building programs actually that can, it's not plug and play necessarily, with a little customization to your business, then you can at the very least deliver good services. Then you're working towards outstanding services.
Work. Yeah.
Exactly. But also there's need for education, leadership and management in health and social care. It's overlooked. I know we've got colleagues like Dr. Brighton Chireka with his Doc BC Academy and other people that we've worked with that are really working hard to try to build programs, and leaders as well appreciate that they need to train themselves and their managers and staff into leadership positions, but also understanding that regulations are not static; they're constantly evolving. The fact that you've got a policy or procedures that's working right now, you're one incident away from that thing being completely irrelevant.
Void.
So these are evolving. So people tend to take templates and then use them, and then they're filed away somewhere. So when the regulators come in or commissioners come in, I can show them where they are. But actually, that's only a start. It gives you a starting point. Then you now need to work on culture. You now need to work on getting people to appreciate actually that technology is here to stay. It's going to help us improve what we're doing. It's not going to take our jobs away. It's not going to replace people. You still need human touch. Health and social care, touch itself actually is crucial. We use it as part of the diagnostics, reassuring patients as part of treatment.
You can't replace that.
You can't replace that. You can't replace human beings, the empathy side of things, the reasoning. Yes, we can have as many artificial intelligence tools that now reason like human beings, but they're not going to replace people. They're tools that we're going to use to help us do our jobs better. So I'm looking forward to you and the team, the IT teams, integrating more, adding modules to the software so that we help organizations not only meet the regulatory requirements, but actually deliver services that are fit for purpose and better outcomes for service users. We have an aging population. People are sicker, getting older, on many medications, strain on resources. We need to be part of the solution. And like I said, I want to challenge. I'm going to take up the challenge with the government. They're saying, come forward. We should go to Westminster and talk to them. We should go to talk to the local authorities, talk to the mayors, talk to the regional bodies. Actually, we need to stand up actually and be counted, because otherwise we'll see things being done in the sector that we've invested so much in, the sector that we've built a business and lives in. Every year things get worse and worse. Declining, so that's what I'm looking forward to, sort of say more integration, more collaborations, and using a lot of these software solutions actually to improve how we deliver services.
Yeah, I echo all those things. I suppose one of the other interesting things that the business will be going through next year is the rebrand.
Oh, yes.
Some of you may know who've been keeping on top of my LinkedIn posts that we're rebranding from LearnPack to ComplyPlus. So we'll be taking some tips from Elon Musk and looking at how Twitter perfectly did it. And I think that's on more of a fun side. That's one of our things for next year, because a lot of people out there will know us as LearnPack. Obviously, we rebranded and trademarked to ComplyPlus over a year ago now, but as many of you will know out there, rebranding takes time, and that's something that we will be working with different advisors and people within the business to achieve. But other than that, I completely echo your thoughts. It's looking again, continually doing analysis with customers, going out and seeing more people. I think being more present, like you say, in Westminster and in the capital, attending more of the events that you've been attending personally recently, and just keeping on top of things, because everything's changing so quick. So we'll recharge the batteries. Even the format of this podcast, actually, I'm looking forward to some of the changes that we'll be doing. You'll see some different faces, which will be nice for some of you. All very, very exciting stuff. So, I look forward to being back in January.
Yeah. So maybe you can also remind people out there, ComplyPlus, why ComplyPlus? Why rebrand from LearnPack to ComplyPlus? Because I've had people ask me, I remember we had a client that I went to see in the West Country, and they're saying, look, I got a bit confused. There's LearnPack, there's mandatory training group, and I'm now seeing this
seeing another name.
ComplyPlus. Well, what is that all about? So then I had to explain, because we were transitioning from LearnPack to ComplyPlus at the time. We were actually waiting for the trademark approval. What is it all about?
Well, yeah, LearnPack was an original idea when we went into the sort of training sort of space, and it was primarily used as just a learning management system tool. So it was a system that held content. It gave people the option to obviously go online, complete this content.
So e-learning
had
platform.
reporting tools. So ultimately, in a nutshell, it was an e-learning platform.
Yeah.
Obviously, with some of the things we've discussed today, and even on the last podcast we did, and even some of the things we've been writing about in our blog articles recently, there's been a lot of changes. And just having LearnPack LMS, we felt, wasn't quite cutting the mustard in a way, not just from a name perspective, but even its purpose perspective. So we've had to diversify. ComplyPlus, I think, perfectly summarizes everything we're trying to do. We want people to comply, and we want people to do it well. Hence the plus, it's a positive, and we want people to do it well and find it easy and not be worried about, complying, whether it would be with regulators, or whoever else is auditing that particular service. So ComplyPlus then helps us encompass some of the other features that we've built on the platform, particularly in the last 12 months. Your policies and procedures, your workforce development, your different types of reporting, your document repositories,
Feedback as well.
The way
The evidence,
feedback, the evidence. Even with CQC, that it's a lot more evidence based now. So we had to react to that. We had to build things into the system. So just pigeonholing it as an LMS and LearnPack, it didn't quite feel
limited.
right.
Limited.
So the company, we made the decision over a year ago now, but that rebranding process will be in more full swing next year. And like you said, when you've got different names floating around in the public domain, you don't want that confusion. It's not good for us. It's not good for the people we serve.
So
it's an interesting project that will be is already in place, of course. A lot of our active customers particularly will be aware, even some of you that keep an eye on what's going on our website and different publications we put out. But we'll be doing more work in that area next year, so that LearnPack lives on, but it lives on within ComplyPlus.
So LearnPack is the name of the company anyway, LearnPack Systems.
Yes, that's
then
the registered
LearnPack
company.
platform was the LearnPack LMS. The mandatory training group remains because although we have moved so much away from just training, it's the brand that is recognized out there, but it limits us to just training. That's why
Exactly.
ComplyPlus, which is the platform now that is powering everything that the mandatory training group is encompassing. So the consulting, the software packages, workforce development solutions, induction programs, supervision, and then meeting the CQC's new single assessment framework. Although I don't know how long it will last the way it is, but something like ComplyPlus allows you then to adapt to the legislative changes, regulatory requirements, shifting, flexibility. Yeah, look, it's going to be exciting time because our friends at Spaghetti, I remember when we were talking to them about this, and they outlined to you what you need to just consider brand change, But I think this year the work that the team have done has been incredible in updating the system, but also educating people on how to use ComplyPlus. The demos that they're doing with prospective clients or clients that are already existing, and showing them how to use the system and improve their usage of the system. So I'm looking forward to that as well. Our product team, because we've built a really good product team that is very knowledgeable about the platform, but also they keep learning and challenging us actually. So we are more data driven in sort of say, look, even if it's one client needing customization, okay, look, what would be the benefit to all the other users, so we can scale it and then use that client as our pilot in a way. So I enjoy doing that because, again, you're solving real problems.
Yeah, real life.
Real life problems, one client at a time. But actually, because we're looking at a whole workforce, you can then scale it nationally and even internationally sometimes. So yeah, I'm looking forward to the break as well, recharging. Any plans for Christmas?
Nothing too exciting now. Staying at home with the family, but I'm sure it'll be nice. And as you say, gives you a chance to recharge, come back in the new year refreshed and ready to go again.
Yeah. So thank you to people that have supported us throughout the year. 2024 has been a fantastic year for us.
Yeah.
We faced some challenges which we managed to get past, and the business is growing. Our clients that have been loyal to us, we're very grateful, and even some of those that may have left us because for whatever reason, we thank everyone and even team members, past and present, who have helped us build this business. We're looking forward to 2025, and there's a lot in store, and enjoy the festive season. Merry Christmas, and hope you have a wonderful New Year. We'll see you in January. Thank you.